COVID-19 pandemic started, the Maryland Food Bank has added about 90 new partners to its network of organizations who are out there distributing food to the growing number of food insecure families.
And one of those new partnerships is a food pantry inside of a pediatric clinic at Johns Hopkins Children's Center. A first of its kind for the food bank. WMER2 News' Megan Knight has the story.
Inside the Harriet Lane Clinic at Johns Hopkins Children's Center, there's a closet near the exam rooms that's now a mini food pantry. It's the newest service they offer to families who come for a visit.
Hi, I have the food we talked about.
We like to really look at it as like a one-stop shop for our families when they come here, and we can provide diapers and connect to a number of other resources while they're here for their medical care.
Kristen Topel is the program manager of Hopkins Community Connection, which oversees the resource desks at the clinics within the hospital. She says over a year ago, Johns Hopkins and the Maryland Food Bank launched a pilot program to start a food pantry inside the Harriet Lane Clinic.
We really brainstormed, how does this make sense to bring a pantry into medical care like this? And it was just a beautiful partnership from the beginning, and it so turned out we were ready to open the pantry in mid-March, right when everything really started changing for our families.
And the timing changed things for the food pantry too, because the clinic initially thought it would serve maybe 20 families a month. But since the start of the pandemic back in mid-March, they've given out food to about 200 families.
And I'll say in the beginning, we could not keep it stocked fast enough. It would come in and it would be gone immediately. We know how important this is to the overall health of our children and their families, and it's not the time to tell families our pantry is out of food.
The Maryland Food Bank is working closely with the clinic to ensure no family leaves there without meals to take home. This is the first time the food bank has set up a pantry inside a healthcare center, and it likely won't be the last.
We are absolutely looking at this as something where we will take it and sort of write it up and turn it into a series of best practices that we can use with other healthcare systems across the state.
Both Hopkins and the food bank consider this food pantry to be a success, even as it goes through what will be one of its most challenging times in its existence. It's also been a great learning experience for both institutions.
What Hopkins was able to bring to this partnership was that they are addressing food insecurity, but also looking at the root causes, the drivers of food insecurity in their patient population. And that's very much lined up with where the food bank is right now.
You know, we were really new to this, and what a time to open a pantry. So without their guidance, I don't know where we'd be, but they've really set us up for success.
In Baltimore, Megan Knight, WMER2 News.